So one of the known health hazards that is associated with so much of the health risk is tobacco use. There are various ways that people use tobacco. There is those who smoke, there is those who snuff, and there is those who chew tobacco. What we should realize is that tobacco use is a chronic relapsing condition that needs treatment. The unfortunate thing is not many patients will present to the health services because they have a smoking problem or a tobacco use problem. But then patients present with themselves to the health facility due to the complications of tobacco use for long periods. Some of those which include coronary artery diseases leading to heart problems and also heart attacks. We have strokes, various cancers of the esophagus, the oral cavity, and are associated with tobacco use. And also, it has also been shown for women to affect pregnancy outcomes and also the baby outcomes. So this is one of the challenges that health providers have to be conscious always that most of the patients whom we see, they most likely could be having a tobacco use problem. So it is always good as a health provider to have some knowledge how to handle tobacco use. And there is what we call the 5 A's of the tobacco use, which health providers would always be able to do in any health visit. One of them is, the first A is ask. For all patients who present to the health provider, ask about the tobacco use and ask how much the patient has been using it, the duration, how the patient started smoking, if the patient is aware of the negative consequences of tobacco use, and if the patient has ever tried to quit smoking. And always when you are doing this, try to avoid being judgmental. Then the next A is advise. Advise the patient to quit smoking in a very personal and positive way, and recommend it to the patient that it is for their good, for the good of those who live with them, and for them to quit smoking. Then assess. There are various scales of assessing the readiness of the patient to quit smoking. Then try to understand why the patient wants to quit smoking, and also assist the patient to make a quit plan. Make the plan as personal as possible, and also try to involve the engagement of those friends and family members of the family. Then the other thing that would be good to do is to allege. Allege means you allege for the patient follow-up, so that after you talk about the tobacco quitting, then you see what steps the patient has taken, and then encourage and support any success that the patient has gained. So then if you realize that they have serious problems in the quitting process, then you may need to refer them to the appropriate people who will be able to help them to quit smoking. There is the behavioral way of quitting smoking. There is also nicotine replacement therapies, which come in various forms, and you should inform patients of these available means of quitting tobacco. So for those of you who are there, who are also have tobacco use issues, I highly encourage that you consider that this is one of the biggest health hazards that has effects on your psychological, emotional, physical health, and also the people around you. So take it seriously, and consider quitting as one of the ways to take care of your health and the health of those allowed you. Thank you.